What's up, friends? Welcome back to KimmyDTV, a place where health professionals come to achieve academic, career, and life success, okay? In this channel, we talk about how to succeed in your career and your education and your life so that you can be on your way to living your best life in your terms, okay? So if you like those kind of videos, don't forget to hit the like button, hit the subscribe button, hit the notification bell so that you never miss a video. Share this video to everyone you know, your friends, your family on Facebook, because I believe that this video will be extremely helpful, especially for my healthcare professionals out there who have recently moved or are in a situation in life where they need money, but at the same time they would like to create their own hours and basically become an independent contractor. This video, and it also helps my channel and lets me know that you guys like these videos from me, okay? So just a quick background story about me. My name is Kimmy D. I was an LPN for 7 years, and now I have been an RN. At the end of May will make me 6 months, okay? Time goes by super duper fast. But in this video, we're going to be discussing how you as a healthcare professional can become an independent contractor, can work for yourself, basically. Wherever you are, you can work for yourself, okay? In a matter of a week or less, okay? So let's get to it, okay? So a quick backstory about me. I'm originally from New York, but I recently moved to Houston, Texas in January from my travel nursing assignment that I did for a month in Fort Worth, Texas. And when I first moved here, I moved very abruptly. Yes, I planned, but I could have planned more. So I really needed cash now. I had some interviews lined up, but at the same time, I really needed some money because I was moving across the country from New York to Houston, Texas. And I needed money because I needed to fund my apartment, my car, furniture in my apartment. Child, I needed money, and I did some research, I did some digging online, and I found something where I call the Uber of nursing, okay? Or the Postmates of nursing, okay? So if you guys ever did Uber or Postmates, I did. I used to be a Postmate. In Postmates, you get to work when you want and where you want, how you want, okay? So in Postmates, you basically download an app and you could turn on when you want to work. And when you turn on, you see a gig. Hey, this person needs someone to pick up this food from Burger King or pick up these supplies from CVS, and you could decide whether you want to take that case or not. And you basically pick it up, you pick up the food, you walk or you drive to that person's location, your client's location, and you give them their food. You let them know, hey, I'm on my way. You get extra ketchup, extra sauce, and they give you a nice tip, and you work. But the great thing about Postmates and Uber, when you work for Uber and Postmates, you make your own hours, okay, which is amazing. Who doesn't like that? Because as you guys may know, like, I live in Houston, so if ever I want to go to New York to visit my family, or if I want to go to Florida, I have some family in Florida, if I want to go on vacation or anything, sometimes when you work for an employer, not sometimes, all the time, like for a hospital or nursing home, if you work directly, sometimes you always have to ask, hey, can I go? And there's nothing wrong with that. But sometimes you have to be approved, okay? Sometimes you have to be approved, okay? So if you're not approved, then you can't go. So, you don't want to miss your kid's basketball game or soccer game or whatever. Like I said, I'm not totally against that that process, and I understand that because they need to make sure that there's nurses, CNAs, or healthcare professionals there. But, right, this channel is about how we can make our lives, right, as a healthcare professionals easier. So if you are interested in becoming an independent contractor and working when you want and being paid extremely fast and well, then stay tuned, okay? So basically, this is a review of the Kare app, but on my channel, I welcome other people to comment down below in the comment box and tell me share with us other apps that you know, or other programs or whatever that allow healthcare professionals to work when they want to, okay? I know some other apps here in Texas. One of them is called Nurse Dash. I'm not sure if they're in any other city, but I know Nurse Dash is one of them. If you guys know, please leave in the comments down below because we're all helping each other, right? Okay, so this review is going to be on the Kare app, and stay tuned at the end of the video. I will let you guys know the cities where the Kare app is currently working, okay? So I'm going to give you guys the pros and the cons of it. This video is actually not sponsored by Kare. What is the Kare app? The Kare app is actually not a staffing agency. The Kare app basically removes the middleman from you and the nursing home or the facility or the hospital, whatever, wherever you want to work. It removes the middleman, so you could just speak directly to the nursing supervisor at a nursing home. You ever see a nursing home or a hospital that you want to work in, you're driving on by, you're like, man, I just wish I could just start working. Like, I'm a nurse, or I'm a CNA, or I'm a medication aide. I know what I'm doing. I can work anywhere I want to. All I have to do is just go in and work. I know I'm reliable. I know I'm a great person, but sometimes we have to jump through hoops, right? We have to either fill out an application process and wait a while to get an interview, and then we hire directly for the company, or we have to go through a staffing agency, right? For those of us who love PRN work, we all know we have to go through a staffing agency. And nothing wrong with a staffing agency, it's just that sometimes, you know, there's loopholes behind that. Like sometimes they ask you, or when do you get paid? How do you get paid? This and that. So to remove that middleman to decide when you want to work, okay, on a weekly basis, on a daily basis sometimes, this app is amazing for it. And this app is called the Kare app, okay? So the Kare app actually is not just for nurses. The Kare app is for nurses, CNAs, and medication aides, okay? So the Kare app basically allows you to work when you want, where you want. So to start working for the Kare app, you actually have to download the app, right? So you download the Kare app and you basically choose when you want to work, okay? So for example, I open the Kare app right here, and I see that, like, for example, Kare aide from 6 to 6 at this healthcare center, a floor nurse job from 6 to 6 at this healthcare center, and it tells you how much they're paying, right? And sometimes, especially if it's the weekend or if it's a holiday, they will put in bonuses, okay? So they will put in like $100 bonus, right? Or a $50 bonus or an $80 bonus. So if you pick up that shift, you actually get a bonus, okay? But in order to get the bonus, the person who, after you work, the person who reviews your shift, so after you work a shift, the person has to verify that you actually work the shift in order for you to get paid, okay? So for example, I have this one nursing home that that's not too far from my house, maybe 15-20 minutes away from my house, and I know the supervisor, I know the people there, so, and sometimes they text me like, hey, do you want to pick up this shift? Can you please go on the Kare app and pick up this shift? And I know that they're going to verify my shift. I text them, I say, hey, can you verify? They verify me. If I have the 5 stars, they're going to go ahead and give me my bonus, okay? So please, you have to be a reliable person when you sign up for the app, because if you sign up for the app, if you sign up for a shift and you cancel last minute and last second, if you cancel in advance, okay, but if you cancel last minute and you keep making it a habit, these facilities are not going to want to use Kare app, and your reliability score will actually go down, and you negatively affect Kare. So please, if you want to use this app, make sure if you take a shift, you're actually going to work it, because I don't want you to ruin it for the rest of us. Okay, you have to say it, okay? It's a 10 out of 10, okay? So it's out of 10, so 1 to 10 is your reliability score. So when you choose to accept a shift on the app, usually the facility can text you and say, hey, are you ready for the shift? But what I did, I took it a step further, because when I first came here, I just really wanted to hit the ground running and working. I actually Googled the name of the place, and I called and I asked to speak to the supervisor, and I said, hey, my name is Kim, and I just applied for a shift on your app. I just want to know if you see it. If you need my help, please let me know. Is there any other step I should take? Because I wasn't too sure exactly how the app worked. I never use the app. Mind you, I've been a nurse since 2013, and this is so like evolutionary, okay? It's so amazing. And then she's like, yeah, let me just approve you real quick. And that's when I started to build that great rapport with them, okay? So what else goes into the reliability score is that actually 2 hours before your shift, there's something that's gonna pop up and say, are you ready to go? And you have to click ready to go. Don't not click it, because if you don't click it, it decreases your reliability score, because that's one of the ways you can decrease your reliability score, because ready to go lets the community know that, okay, hey, she's aware of her shift, she's not canceling, she's on her way, she's traveling or whatever. So that's 2 hours before your shift. When you see the ready to go, you're gonna click on your phone, on your app, ready to go, and then you can go on your shift, okay? So clocking in, okay? So the Kare app, keep this in mind, it goes by your Wi-Fi or your cellular data, so it could tell where you are. So once I drove to this facility, it automatically clocked me in. If it doesn't clock you in, you could physically, clock yourself in. And of course, at the end of the shift, somebody has to verify that you were actually there, that you actually worked the shift. So it automatically clocks you in. So it sees if you're late, if you're not late. So being late also affects your reliability score, okay? Breaks, you're supposed to take breaks, yes. Breaks past 30 minutes is actually considered like time off, and they won't pay you for that. So make sure you keep your breaks at a minimum of 30 minutes or less, okay? So so some of the things that I had to do to even get into this app is I had to give a copy of my TB test, a copy of my BLS or CPR certification. I had to do a background check, and I had to do like a brief short interview over the phone, and I had to give my driver's license or government ID and my healthcare license. So all of that was actually, they went through my name and they found my healthcare license, because my original license is in New York, because but they found my license for Texas, and everything was uploaded, and I uploaded everything else. I uploaded my TV paperwork. So just make sure you have all your healthcare paperwork. This is my advice to all healthcare professionals. All your medical stuff, everything you need to work, make sure you have it in a folder, so that when you have a great job opportunity, you don't have to delay the time. You can just take a picture of it, upload it in the app, and there you go, okay? So, and they can see it. So you have tabs on the app. You have a tab where it says shifts, where it's active, and your past shifts. So you can see your past shifts, how many shifts you work, and stuff like that, and if it was verified. So you want to make sure in your green tab that is verified. So you're going to see several tabs, right? You're going to see several tabs on your phone, and you're going to want to make sure when you go to my shifts, you're going to see several tabs. You're going to see active, and you're going to see past. I don't want to show you guys specifically, because I don't want to share the information, but it's going to show all the shifts you work. So it's going to show all the past shifts you work, and then verified means shifts that you were verified for, like the facility said, okay, yes, she was there, but you haven't been paid yet. And then the last tab says paid, and it's going to show you all the shifts that you were paid, okay? So all your bonuses and stuff like that, okay? So the great thing I like about this app is that you could get paid the very next day. How soon can you get paid with the Kare app, okay? So this is how they do it. So let's say your shift ended on Monday, and you checked out, and your time was verified before 8 p.m. You get paid by Tuesday by 5 p.m., okay? So let's go through that again. So let's say your shift ended on Monday, and you checked out, and you clocked out, and your time was verified before 8 p.m. Central Standard Time, you get paid Tuesday by 5 p.m. because they run by Central Standard Time. You get Tuesday by 5 p.m. So it's not just about what time you clock in, it's what time your supervisor, whoever deals with it, what time they verify you, okay? So sometimes, if I want my money next day, I will call her and be like, hey, don't forget to verify me, please, and whatever, okay? So usually when I worked, I would get paid in 2 days, because if I'm working 2 to 10, for example, then most likely it's not going to be verified before 8 p.m. Then it'll be verified the next day, so I'll have to wait a little bit, okay? And you get to take home all of your money, because you are an independent contractor. You get to take home all of your money, and there's actually some, however, just because you could take home all of your money doesn't mean you spend it all, because, you know, at the end of the year when you do your taxes, you're gonna have to say, hey, and I know, because, you know, I do YouTube, and even though I don't do YouTube full time, it's still considered a business. So my taxes are, when I pay to get my taxes done, it's automatically higher because YouTube is considered a business, right? So you are going to be considered to have your own business too, because you are your own business. Okay, so you would upload your banking information as well to get paid direct deposit. Stuff that you can deduct from your taxes, such as mileage, part of your cell phone bill. Like, you know, when you have a business, you have to think about what you use, like maybe your uniform, maybe part of your cell phone, because, you know, you're using your cell phone, your cellular data to access the app, mileage to and from. Oh, I gotta do all this at the end of the year to make sure my taxes are right. But you want to account for all of that so you can get as much, you know, deducted, you know, from your taxes, okay? But that's the only thing you have to remember. Like, just save a little bit of money on the side, especially if you're going to do this full time. Save a little bit of money on the side so that, you know, you make sure that if you owe a lot, that you're able to pay a lot. But seek out a financial advisor, someone who is well educated and well versed in taxes, because it's not gonna be me, but that's soon gonna be me, because I'm gonna have to do my taxes. The only cons that I don't like about it is actually the taxes thing, because it's like, I don't know, like, how much to take out, how much to not take out. So I'm a little apprehensive about that. And another con, I don't know about the other cities that they service Kare, but in Houston, the pay that they give is more like for LPN pay. But I don't know, I see that in my mind, it's more for LPN pay. It's more like LPN in New York pay, so maybe that's okay. Like I said, I'm coming from New York, so I'm coming from a certain standard of pay, but when I see the prices on there, I say, okay, that sounds like New York LPN pay, right? But when you get your paycheck, it looks like RN pay because they don't take out the taxes, right? So I'll give you some of the prices I see here. Like for Kare aide, I see $14 an hour. For floor nurse, I see $25 an hour. Kare aide, another $13.50. Floor nurse, $25. Kare aide, $11. I don't see the medication aid right now, but let me see if I can search medication aid for you guys. Medication aid, $15 an hour. Medication aid, $12 an hour. $13.50. Okay, and they have various times that you can work, like 8-hour shifts, 12-hour shifts, so that's good. But I'd say that's the only con. That's the only con to it, is that, you know, that. And they actually have like a care club, friends with friends, and basically like it's this new program where if you refer someone and they work and you work and you guys both work a minimum number of shifts a week. So now they have the Care Club where you can make a little bit of money. So you guys could go on the website and find out a little bit about that. Okay, so all right, so that's a great way to make money. Right now I don't use it so much. I just use it if I have an emergency, because right now I'm working PRN, so I can basically work when my facility has needs. And I'm working PRN somewhere else now, so I only use it when I have to use it, just because I'm finding that I'm making more money as an RN if I work for an agency PRN than for that app. I don't know if they're going to change that in the future, But yeah, so far I just see that they mainly do like LPN New York kind of pay, and I think that's because maybe it's because it's a nursing home. I don't know what the reason is. Maybe somebody can clarify and let me know why below. But yeah, I still think it's a great opportunity. Help me pay for a lot of stuff here. If you want to get paid right away or within 2 days and you don't want to wait and you don't want to pay, like, you know, sometimes they have apps or programs where you could get paid the next day or right away, but they take a percentage out of your money. This is not the case. You can make it right away. And I just think I want to make this video because I just think it's a great way and it's a great thing to share. Like, hey, like, even if it's not the Kare app that's in your city, maybe it's not, maybe you don't see it in your city, maybe it's not as prevalent, but maybe you can just Google, do some more research and see how you can work for yourself. I wish I had that when I was in nursing school, because sometimes I would schedule myself a week in advance for something, but then dang, like a test came up or an extra assignment came up and I didn't feel like going because I just had so much work. But with this app, you can work when you want, where you want. That's amazing, you know? So, and you're an independent contractor. That means you can do doubles every single day this week and decide, hey, I'm going to Jamaica next week, so I'm going to do my doubles, stack my cash. I don't have to ask anyone. And I think that is amazing, okay? So I hope you guys enjoyed it. So I'm going to tell you guys the city that they have it in now is Colorado, specifically Colorado Springs, Denver, Jackson, Florida, Miami, Florida, Orlando, Florida, Sarasota, Florida, Tampa, Florida. In Georgia, they have Athens, Atlanta, Gainesville, Savannah, and Idaho, Boise, Illinois, Chicago, in Nebraska, Lincoln, Omaha, in New Jersey. New Jersey is fairly new, so that's for the East Coast. Unfortunately, they don't have Brooklyn. Brooklyn has too many nursing agencies, but don't worry, Brooklyn. Ohio, Akron, Cleveland, Columbus, Tennessee, Memphis, Nashville in Texas, Austin, Beaumont, Byron, College Station, Dallas, Fort Worth, El Paso, starting soon. See, and they're constantly adding. So depending on the time you're watching this video, always go back to see if your city is actually in the Kare app. Houston, that's where I checked off now. Huntsville, Midland, San Angelo, San Antonio, Sherman, Temple, Tyler, Waco, all in Texas. And that's great because, like, if I'm, let's say I go to New Jersey for a second, if I don't want to work, I could just go on my app, click I want to work, and that's it. So, you know, you get notifications all the time. Sometimes it can be annoying, like bing, bing, take up the shift, but you can work when you want, how you want, where you want, and that's amazing. You know, you still have to work, but you decide when you want to work, and that's a lot of autonomy, and I'm all about being autonomous. All right, so guys, I hope you guys really enjoyed this video. Thank you so much for taking the time out of the day to watch this video. Please, please, please give this video a like if this helped you in any way. Share this video with a friend. Subscribe, hit the notification bell, and I'll see you in my next one. Bye.